Hello, my name is Dr. Lonnie Herman, and I'm going to showcase in this video examination details and diagnosis details about Kaylee. Kaylee has had amazing recovery in my clinic with my unique work, my rapid health recovery system, which has helped her regain her life. Many people have asked me online, how is it that Kaylee has gotten over her corn allergy? How is it that she does not suffer joint dislocations that were linked to a diagnosed Ehlers-Danlos syndrome? How is it that she doesn't have symptoms for POTS anymore, POTS disease or POTS syndrome or dysautonomia? How is she able to function normally? She had gastroparesis. She had constant vomiting, several times a day vomiting. She couldn't even drink water and hold it down. She had multiple symptoms, multiple visits to the ER before coming to my clinic, and now she's 100% better. So I want to be able to show you right now, I'm going to put up next to me here for all the questions that I have gotten on my YouTube channel about Kaylee, and some negative statements. Again, how could it be possible, or she had the wrong diagnosis? Well, we're going with what her diagnosis was by this hospital, which was in Florida. I'm going to show you this, which is diagnosed by her medical doctor. She had a diagnosis, and I'll put the page right up next to me here, her medical history. She had a heart murmur. She was diagnosed with Ehlers-Danlos syndrome. She was diagnosed with syncope, which means fainting when standing up. She was diagnosed with Tietze syndrome. She was diagnosed with POTS syndrome. She was diagnosed with asthma. All of those symptoms is what she had when she came into my clinic. She suffered multiple joint dislocations. She went into anaphylactic shock from just trying to pump gas at a gas station. She'd faint. She couldn't pump gas. She couldn't even smell popcorn because she would break out in bleeding blisters in her mouth, and she had this throat that would swell up, and it was really bad. So I'm going to just put some highlights of her video, of her testimonial here, but there's so much. There were so many symptoms that Kaylee suffered, and it would take a very long time to go through all of it in this video. And it took us some months, but she is now 100% better. I want to go over in this video a few of the findings that help me help her stop her corn allergy, because she can eat corn now. There's no more corn problem. She doesn't have the joint dislocations anymore. She doesn't have the pains in the body. She doesn't have the vomiting. She doesn't have the POTS. She doesn't have any of those symptoms anymore. I'll tell you, when I first started working with her, one of the first things that I found was that she had multiple, 1, 2, 3, 4 parasitic infections in the pleural cavity, which is around the air, if you will, cavity around the lungs. Her diaphragm had a parasitic infection. When the diaphragm is infected, it pushes up against the lungs, can push down against the stomach, cause some of the stomach discomfort, as well as shortness of breath. She had malaria parasitic infection, a Giardia parasitic infection that was in the pleural cavity. She had malaria parasitic infection in her esophagus. She had Giardia parasitic infection in her esophagus. She had influenza in her stomach. She had the Giardia parasite in the blood vessels called the arterial or vertebral arteries that run along the cervical spine that go into the brain. She came back to me for another examination in my clinic. I found that she had the botulinum toxin in her liver, botulinum toxin in her stomach, botulinum toxin in the inner lining of the stomach, botulinum bacteria and the botulinum toxin from the bacteria in her kidneys. I found thimerosal, which is from vaccines, which is a heavy metal, very toxic mercury from vaccines, in her kidneys. I found the botulinum toxin and botulinum bacteria in her pancreas. And these liquid energized drops that I provided her helped her combat these different infections and chemicals and get them out of the body. I'll show you a brief video here, a small section of a 30-second video where it shows how the frequency was used to target the parasite infection inside the cell. When the frequency targeted the parasite was destroyed. And that's real. I found that she had, in another examination with me, that she had Lyme infection in her kidneys, the Babesia microti parasite affecting her kidneys, Ehrlichia bacteria and Coxiella burnetii, also called Q fever, in her kidneys, dengue fever virus and chikungunya virus affecting her kidneys, Zika virus affecting her kidneys. I found the Brucella bacteria in her left kidney. The kidneys help regulate blood pressure. Blood pressure regulation by the kidneys gets enough oxygen to the brain. What would happen when the kidneys are infected and any chemicals in the kidneys? What would happen? Have you ever thought of that? Doesn't necessarily mean you're going to have a urinary tract infection symptom. Doesn't mean there's a UTI. Maybe there is. But what can also happen is the kidneys become weak and they don't help you regulate your oxygen to your brain, and that can cause POTS. That can cause syncope. That can cause headache. That can cause fatigue. I also found that she had the influenza virus in her hypothalamus. The hypothalamus helps to regulate organ function, heart, stomach, intestine, kidney, liver, pancreas. The hypothalamus is also a hormone control. It is the chief conductor of the entire endocrine system. What would happen to your hormone balance? What would happen to organ function when there's a virus or a chemical, or there's candida, something that gets up into the hypothalamus? You can have disorder in the body. I found that the capillaries, which are blood vessels that help you exchange oxygen for carbon dioxide at the tissue level in the brain and in the body, her capillaries had a candida infection called Candida krusei. I also found that she had the Babesia parasite in her bone marrow, dengue fever virus, and streptococcus bacteria affecting an artery in the brain called the basilar artery. I'll show you an image of where the basilar artery goes. Just imagine the artery is infected in your brain, and that artery is going to be inflamed. And the immune system will attack that artery. And then you can have more inflammation. And then what happens to the amount of blood flow with oxygen getting through to that tissue? It's going to decrease. And then what happens to the inflammation pattern that's going on around that blood vessel? That inflammation pattern will seep into other parts of the brain and can cause organ decrease, body function and fatigue, and things can change. Malfunctions that you can experience or symptoms. She came back for another examination, and she was already getting better, but not 100%. I'm going to just go through the list of these, and I'm going to tell you that she has 100% relief of all of the symptoms. No more of the Ehlers-Danlos syndrome, whether you want to call it Ehlers-Danlos disease, whether you want to call it Ehlers-Danlos or you want to just say that she has a congenital ligament laxity. You call it what you want. She was diagnosed by a medical practitioner in her hospital with Ehlers-Danlos. She walked around with Ehlers-Danlos as a label. She had the tight C syndrome. She had the syncope, the heart murmur, POTS, asthma. All of these symptoms are completely 100% relief. I found that her amygdala, the part of the brain that regulates fear, panic, anxiety, it can cause your heart rate to go up when it's stressed, and also can cause stomach disorders. It can cause digestive problems because the amygdala, when that's stressed, it can change lots of different organ functions in your body. It feels like the body's under a panic state, chronic fight or flight, if you know about that. Well, I found that she had a tick-borne encephalitis virus affecting her amygdala. I also found that there was the chikungunya virus affecting the amygdala and the influenza virus affecting her amygdala. I found that the influenza virus and the malaria parasitic infection affecting a part of the brain called the diencephalon, which helps to regulate many brain and body function. I found that she also had the tetanus bacteria and the E. coli bacteria and the mycoplasma bacteria. That was tetanus, E. coli, mycoplasma infected her vagus nerve. The vagus nerve helps you regulate many parts of the body, including but not limited to the stomach. So when the vagus nerve gets infected, it can cause a disorder to the organ that the vagus nerve supplies information to, and also can cause a disorder to the part of the brain stem where that vagus nerve stems from. And that can cause more of an inflammation and malfunction in different parts of the brain and other parts of the body. She came back for another examination, and we found that there was no more stress at the corn. She had multiple symptoms had been completely relieved, no more joint dislocations. She just felt great. She had no more nausea. She had no more coughing. She had no more allergies to things. It was already getting a lot better now. I found that her stomach, in the follow-up exam, and now we were testing against the wheat gluten, And because when she had wheat, she had thrown up. So I had to figure out why that was happening. Well, I found that the wheat was stressing her because her stomach was infected with multiple infections. She had St. Louis encephalitis virus. She had ringworm fungus in her stomach, She had aspergillus fungus in her stomach. She had candida parapsilosis in her stomach. She had mold in her stomach. She had Roundup weed killer spray affecting her stomach. She had mold in the small intestine. She had candida infection in her liver. She had influenza infection affecting the lymph vessels of the intestine called the Peyer's patches. She had influenza virus in her spleen. She had West Nile virus affecting her stomach. All terrible infections. She got rid of those and came back to me for another examination. And she was a lot better, but there was still a little more cleaning up to do. I found in the next follow-up examination, because some emotions were tied to some previous stresses in her life, and we had to rid the emotional stress that was deeply embedded in her brain. I'll tell you that what I discovered is that the emotions are stressing the body. Even when somebody thinks they forgave somebody for doing something wrong to them, or that they truly love themselves, but they never really have forgiven themselves for something that they've been dealing with. And without getting too deep into the emotional, which is very important strategy, very important step in strategy that I do here in my clinic to help people get well from chronic ailments. But the emotions, certain things from her past were troubling her, and we used the emotions in this examination to find out what was going on. Well, I discovered that she had in her lymph tissue in her whole body, she had the Coxsackie virus affecting her lymph. She had the influenza virus affecting the frontal lobe of her brain. She had the cytomegalovirus, or CMV, cytomegalovirus, affecting her brain. And there was also, I found the chemicals from not real food. There's a famous fast food restaurant that makes a cheeseburger that's well known, that sold billions around the world. I won't go into the name of this company. I'm not here to talk bad about them, but the chemicals from this not real food that doesn't get broken down in outside, even months or years. There were videos about the cheeseburger not breaking down. No maggots, no mold, no fungus, no ants, nothing when this cheeseburger is left outside. But if it can't break down to nature, it can't break down in your body. Well, I found that the chemicals from that fake cheeseburger were in her liver. I also found DDT insecticide in her liver. She completed that protocol, which was in September of 2020. She is 100% better. You'll hear her in her testimonial videos. She has no more joint dislocation. She can hike, she can walk, she does everything. No more joint dislocations at all. She's 100% better. No more vomiting, no more corn allergies, no more respiratory problem, no more POT syndrome. All of her symptoms are totally 100% gone. You can look into my website, which is www.drlonnieherman.com. Just go to my website and read about the work. Look at the videos on the website. Look at the different testimonials on the different condition pages about different things, whether it's Lyme disease or EDS. You'll see her videos. It is really remarkable what's happened for her and for other people who have come to me for the kind of care that I offer. I've got many years of research behind me in the immune system, the endocrine system, thyroid disease, GI disorders, developmental disorders of the brain, movement disorders like Parkinson's disease, memory disorders like dementia, of heart problems and brain and body function. You can also request a video from my clinic here that I titled About Me. I don't have this video on my website or on YouTube or anywhere else online, but we'll send it to you, and you can hear about my background, about 20 minutes where I discuss my background to become a better practitioner, to help you get better, as well as some about the technology that I'm using in my clinic. That's very effective and very safe. I want to tell you that sometimes it's so rapid, the recovery for a person, that even in one visit, there are times that people have incredible relief of multiple symptoms, but it's not always in just one visit. There's times that it's a puzzle that we have to put together. Maybe somebody has 50 different causes of their condition. Maybe one person only has one. Well, it might take a longer time to relieve the 50 different causes of the condition and get rid of all those symptoms. Maybe that takes a few months. Maybe it takes a couple of years. But in the end, you're going to get better. Because when you rid the causes of your condition, when you find where they are in the brain and the body specifically, like some of the outline I just gave you and reported up some of the findings from our multiple visits, when we can find and remove those from your body safely and effectively, without drugs, you can repair, you can get better. But it might take us some time. That's the reality. It may take some time. The sooner you're better, the better it is for you. The better for me, and the better for everybody out there. Because the sooner you're better, and I'd rather it be sooner. I want you better fast, just like you want your better fast. But the sooner you can get better, the sooner I'll be able to share your success story with my work online and help other people get well. So I'm in it to help you win it, and I want you to win it faster, sooner than later. So you can watch the rest of the videos that I'll put up here on this video of Kaylee's testimonials, and really get inspired and have hope, because you can get better when you do the right treatment. Again, my name is Dr. Lonnie Herman. You can go to my website at drlonnieherman.com. You can call my clinic to make an appointment at 954-370-3100. Excuse me, and I'm sorry that insurance is not accepted here because insurance won't pay me for my services. So read more about that on my website. I've got an FAQ page, a frequently asked questions page, that you can see what goes on with the fees. We're very transparent about everything. You'll know where the clinic is, what airport you'd have to fly into, and many other questions that people commonly answer. Just go to the website at the FAQ page and it should all be answered there. Spend some time looking around on the website. There's a lot of inspirational message on there of people's recoveries from chronic disease, as well as great, in brief, highlight descriptions of the kind of exam findings that I discovered in each patient that help them get better. It's time to get involved. It's time to think outside the box. I look forward to helping you. Again, you can call my clinic at 954-370-3100. You can email my clinic at clinic@drlonnieherman.com. I'll put that here in this video as well. Or you can book your appointment right there on my website. It's got a book appointment page with a calendar, my schedule. You can pick your time, you can pick your day. I'm looking forward to helping you.